This cure research comes from Rise Therapeutics. Rise Therapeutics is on a mission to prevent the progression of type 1 diabetes using an oral therapy called R5280. Most research involves injections and veins and transplants, so it's pretty cool that this is an oral therapy. And guess what? They just enrolled their first participant this past summer. And they plan to enroll 39 more participants in this study over the next year. So the hope is that R5280 will stop the destruction of your body's beta cells in the earlier stages of type 1 when you still have plenty of beta cells left to destroy or left to protect. But this is not an immunosuppressant. R5280 is supposed to hopefully control and change the pathways that normally lead to the development of an autoimmune disease. R5280 is trying to intervene with your immune system, stop it from attacking and destroying the cells in your pancreas that produce insulin by controlling the inflammation and the inflammatory cytokines that contribute to autoimmune disease like type 1 diabetes. Cytokines are like little messengers that work with your immune system. But inflammatory cytokines are obviously doing bad things if they're telling your immune system to rally up and attack your own insulin-producing cells. Rise Therapeutics means business. They have other clinical trials happening right now with drugs to treat cancer, rheumatoid arthritis, and ulcerative colitis. All of their investigative therapies are delivered orally, and they are immune modulators, which means they're changing and improving or perhaps fixing how your immune system works. Their goal is to develop new drugs that can totally change how we treat autoimmune diseases, cancers, infections, and inflammation. Hey, if you liked this video, click like and subscribe to this channel. Thanks for watching.